Hi guys, today we are going to do an NG tube insertion. So first thing you're going to want to do is you're going to want to check the patient's chart for the order for the NG tubing. I just want to make sure that it's in there and what the order is for. Today our order is for decompression. So we are going to also check allergies and any past surgical history there may be listed in the patient's chart to see if there's any facial trauma, including the nose and the face, for surgery and any risks for aspiration. Once we've done that, we are going to gather our supplies, which we have here, and then we are going to enter the patient's room. You'll perform hand hygiene and don your gloves, and then you're going to introduce yourself to the patient and let them know what is going to be happening. So we are giving the patient NG tubing for decompression. You want to let the patient know that it's kind of an uncomfortable procedure, but it is necessary to get that decompression going. Once we have verified the patient's identity, checking the chart and their bracelet, we will ask them any allergies, and then we want to ask them if they have any past surgical or facial or nasal trauma, and then if they have any risk for aspirations. Now that we are all clear with allergies and surgery, we are going to make sure that we provide privacy for the patient and then get started with the procedure. So first of all, we're going to put a towel over the patient and just drape it right across their chest. And I'm going to bring the patient up so that once I start the procedure, we have her in a good position to where I can get to her and it's not hurting my back. So we're going to do that. We're going to put the patient all the way up, and then we're going to put them in high Fowlers. So just raise the bed up a little bit here. All right, so now that the patient is in high Fowlers, we are going to take a look at their nares and make sure that it's clear inside, that there's no obstructions or any polyps or anything like that. So you just take a pen line, take a look, and then you're also going to want to check for patency. You're going to have the patient plug one side and breathe, and then plug the other, and you're going to listen and make sure that you can't hear any like obstructions or anything like that going on. The next thing you want to do is you're going to take a tongue depressor and check for the gag reflex, and just take a look in the mouth and make sure you do their gag reflex. So now that we're done with that, we are going to get out our nasogastric tubing here, and we are going to prep our skin protectant. And then this is our tape to keep the tubing at the nose, and we're also going to measure. How to measure this, you're going to take from the tip of the nose, and it's going to go around the ear, and it's going to go to the xiphoid process, which for me is about 55 centimeters. Then you're going to add another 10 centimeters to make sure that we are in the stomach. That's just about the length you want it. Once you get past the xiphoid process. Okay, so now that we've measured, we're going to mark here that it is 55 plus the 10 centimeters, so that puts us at 65. So we have marked our tubing. I am going to open up this sticker, the tape, so that we are ready for it. And then I'm going to open up the skin protectant so that when it is time to add that onto the patient's nose, it is also ready. So now that we are ready to insert the tube, I'm going to apply new gloves and do hand hygiene. And then we are going to put our new gloves on, and we are going to get started with the insertion. So we have a cup here for the patient, so that once we get to a certain point, once the tube is inserting into the pharynx, that they can drink. For now, we will just leave the cup here because she can't technically hold it. She's not real. So we are going to put some lube here on our tubing to insert. I also like to put my suction syringe here on the end so that when we get to the part to get the gastric contents, we can have it ready to go. All right, and then we're gonna also wanna have a piece of tape just to secure it to the face until we can put the actual tube taping on there. So just have that handy. All right, so we're gonna put lube on there. The patient's gonna stay in this position with their head flexed back, and we're gonna start to insert the tubing. Make sure to ensure the patient, that everything's gonna be okay. They will experience some gagging and coughing, and that's normal once we get to about the 20 centimeter mark. And you're also gonna wanna rotate the tubing when you're inserting, okay? So we're gonna keep rotating while we're going in here, making sure nothing's getting caught up or snagged. And then right about here is when the patient's going to start coughing. So just ensure them that everything's okay, that's normal, and have them drink. And they're going to bring their chin to their chest at this point. This will allow the epiglottis to close and make the rest of the insertion a lot easier while they are swallowing the water. So we're just going to keep going all the way to our 65 mark. And you don't want to push too hard too fast. You don't want to hurt the patient or perforate anything. And you also want to be careful not to get it into the lungs. So we're going to keep on going all the way to 65. So we are at our 65 mark. So I'm going to just temporarily tape this here for the patient. And then we're going to go ahead and use the skin protectant. All right. And then we are going to wait for that to dry and apply the sticker. All right, that is dry. So we are going to apply this. We can remove that tape and secure the tube with the tape. You're going to want to mark right where the nostril is, where the tape is, just so we know that that's where it is, and we will be able to notice if it's moved or anything. So now that that is there, we're also going to, this is our time when we get the gastric contents. We're going to just pull back on the syringe, get some of that contents, and we are going to put it in a little cup and test it, and it should be between 1 and 5. So once we test it with our little pH strip, and that's a great way to see that we are actually in the stomach. And then we are going to, because it's double lumen, we are going to secure this to the patient's gown with a safety pin or something, or an attachment device, just to make sure that it is not leaking any contents and it is secure to the patient's gown. All right, so now that we have that there, we're going to remove this should be at about stomach level for the tubing once it's secured. So we're going to remove the towel, and we are going to remove everything and discard everything here. And then we are going to remove our gloves, do hand hygiene once more, and then we are going to do some oral care for the patient. And then you are going to make sure that you have an x-ray to confirm that the tubing is in fact in the stomach. And once that is confirmed, you are good to go. Sometimes they use a stylet, but we are not using that today. But once you get the patient's oral hygiene all done, you are going to discard your gloves, and you are going to bring the patient back down and lower the bed just a little bit. Make sure that they're in a nice, comfortable position, and make sure that they have their call light. Some things to consider when doing this procedure: it would be a good idea to instruct the patient to maybe give you a hand gesture or something if they want you to stop if it hurts, or they're coughing too much, or they can't breathe. And then some things to look for when you're inserting the tubing: you're going to want to make sure that the patient is not cyanotic, not breathing, and just coughing too much. That's when you would stop inserting the tubing and just kind of reassess or reevaluate. So now that we're done, patient is lowered and locked, and their call light is there. Their tubing is inserted, and I am going to go and document everything that I've done, the pH, the insertion, and how well the patient has tolerated the procedure. And that's NG tubing.